Hello, guys. Thanks for being here today. My name is Lucrecia Martinez, and I have worked in the Los Gatos Clinic of IPM Medical Group since 2005. For about 12 years, I spent hands-on work in our functional restoration program, teaching patients with chronic pain how to do activities at home more comfortable, with good body mechanics, proper alignment, for two main reasons: to prevent and avoid flare-ups and to prevent and avoid further injury. So stay tuned as I try to teach you a few things or two. Thanks.
Okay, guys, one of the biggest things that people struggle with when you have low back pain is waiting in line at the grocery store. Especially nowadays with COVID and with everything going on, there's long lines to even get into the store, let alone to purchase your items once you're at the checkout station. So if you have back pain, I want to really recommend that when you're standing, if you look at my knees, that you are not hyperextending your knees. Don't flex them. You shouldn't have your knees locked. You should have your knees nice and soft. When you extend your knees, it kind of throws your back into an arch. So keep those knees nice and soft, tighten up the tummy, pull it in so that you're keeping your back supported. And one thing that you can do when you're in line is shift your weight from side to side, right? You don't want to rest on a hip or rest on the other hip because then that's putting pressure on your hip joints. You want to just stand upright and just with your knees soft, shift side to side. This will take pressure off of one leg or the other and will help your weight in line feel a little bit more comfortable. All right, guys, we are here in our living room and we are going to sit and get up from the couch. I don't have a single point cane, so my umbrella is going to represent the cane for today. So let's use our imagination. I'm going to put it for here for now. So when you go to sit down, you want to be nice and close to your couch, wherever you're going to sit, okay? And you want to stick out your J-Lo. Everybody knows what the J-Lo is, and from today going forward, you'll never forget. When you're going to sit or lift and carry anything from the bottom up, you stick out your J-Lo. So J-Lo towards the seats. You can always use your hands here, or you can guide there down, okay? Lay back. When you are going to stand up, you don't want to stand up from here using the momentum. It's really difficult and hard on your back, so you want to scoot to the front of the seat. From here, you want to put your strong foot forward, the other foot slightly back. You can use your hands to press off your legs again, and you're going to push up. Again. Push up. You can also use that to sit down too. Now, if you have your single point cane, we don't want to have the cane in one hand and pushing up because that's putting a lot of strain on our shoulder. You want to have the cane right in front of you. From here, you're going to do the same thing, push forward. Chest always leading our way. Again. Good. Okay, guys, I want to go over proper sitting. Sitting is something that we do all the time during our day, whether we're working, whether we're driving, whether we're sitting at the kitchen table, whatever it is. Here's how to sit properly. You want to sit with your J-Lo all the way towards the chair. Now, if you can see, this chair is probably a little bit too high for me. My feet are having a hard time reaching the floor. So I would prop something underneath my feet so that my legs are a little bit more comfortable. But if you see my back, there is no gap between the chair and my back. A lot of times people start to get uncomfortable sitting up straight. It's hard, right? And so you'll see people start to slouch. I have a rule. If your hand fits underneath between your glutes and the chair, that's not good. All that pressure is in your low back. You want to scoot. This feels sitting upright is harder because your muscles are actually activated and working to hold you upright. This is more comfortable because your muscles turn off. You're no longer using your muscles to hold you up, but all that pressure is landing on your discs. So what I recommend is, number one, sit with proper form. Number two, if this gets uncomfortable and you have that urge to slouch, stand up and lean against the wall instead. This will help you maintain proper form and avoid further injury or pain in your back when you get up. Okay, we've dropped our keys on the floor. What's the best way to pick them up? Oops, here we go. So you want to have the keys right underneath where you are going to pick up. And you want to have a staggered step, again, using your strong leg forward. And then you're going to use like a lunge position. If you have a cane or anything like that, I'm going to teach you another way to do it. But if you are okay balancing, then this is the way you're going to do it. Keys right underneath you, and then you're going to lunge down If you have a hard time getting up, you can always put your hands and help push off. Another thing is use your breath to help you. When you are pushing off, you want to exhale during the hardest part of an activity. So if you're here, inhale, exhale going up. Now, if you use a single point cane, you don't have balance, then take a look at your surroundings. Oh, okay, I have a wall right there. I'm just going to kick it close to the wall. That way I can have something to hold on to. And you want to do the same thing. 1 foot forward, you're holding onto the wall for balance. Down. If you need to use the wall, that's fine. If not, you can also lean against the wall and then push off, right? Good. Okay, now we have something a little heavier. How are we going to lift it? This right here represents our heavy item. I want you to remember, stick out your J-Lo. Always stick out your J-Lo. You want to have the item right underneath you, same like the keys, right? Because if it's far out, not only do you have to squat, but then now you're having to reach. That's going to put a lot of pressure on the back. You want to be nice and close up to it. Stick out the J-Lo, remember? You don't want your knees going forward because that's bad on your knees. J-Lo back, chest forward, right here, and up. Okay? All right, guys. Who doesn't love to sweep, mop, and vacuum? All right, but I'm going to show you how to do it with the best form. So let's take sweeping first. I mean, when somebody sweeps, you pretty much want to get the job done. So I see a lot of times people reaching hard to sweep. And again, that's twisting it and using a lot of pressure on the back. So what you want to do is you want to just keep the broom nice and close to you. So it's always right in front of you. You never really want to do these long reaches. Moving and walking with the broom. Moving and walking with the broom, making your little pile, and then walking with it so it's right underneath you. Your posture is always nice and straight. No more reaching or doing it quickly. Just take your time. When your body tells you that you need to stop, take a break. I guarantee you that this dust right here is going to be here waiting for when you feel better. All right? Now let's switch to mopping. When somebody mops, we do the same movement. Right? Does this look familiar? Well, again, that's repetitive movement for the upper extremities and it puts pressure on your back. You want to start off and just keep it nice and close to you. You're walking forward, you're walking back. If you need to alternate, you can alternate small little step sections. And then you move on to the next section, right? Walking with it, walking with it. No more long reaches. Lastly, the vacuum cleaner. Very similar in that it always looks something like this, right? Reaching forward, reaching forward. We don't want to do that. We want to walk with the vacuum cleaner and go back. Walking with the vacuum cleaner. You can churn with the vacuum cleaner, right? You can do a lot of different things, but you're walking with it, almost like if you're dancing with it. No more reaching. Keep it close. All right, time for laundry. Yep, we all love laundry. So a few different ways that you can do it. This basket is actually a little bit too big. It would be more comfortable if the basket that you have is a little bit smaller so that you can hold it better. But for the sake of using what I have, here we go. So we're going to use this front load washer. There's a few different options for proper body mechanics that you can have. Is you can place your basket on top, open the washer, and again, when you are going to reach into this washer machine, use this as a rule of thumb. Put one thumb on your ribs, right? And your middle finger on your hip bone. If you are bending and your fingers come together, that's bad pressure for your back. So when you bend, you want to try to have, again, finger on the rib, middle finger here. You want to be able to bend, but keep the fingers separate. That is called a hip. You're bending from your hips and not from your back. I'm going to demonstrate again. Hips. So what we're going to do is we're going to get the clothes into the washer. You can have it up here. You can also have a stool handy, right? Keeping it in your washroom, wash area, and have it there so it's more at a good level. So you have two options. You can either do the little, like a little lunge hip band and just tossing it in. You can squat down and put it in here, right? Another option is, depending on your limitations, using the stool to sit and be a little bit more comfortable when you're doing your laundry. I know that this is extra steps, but it's extra steps that are gonna help you feel better throughout the day. All right, now your laundry is done and you're trying to get it out. It's the same thing. You can have your laundry basket there. You can sit, and remember, you're bending at the hips. You're not bending down this way. Nice and close. You don't need to see it. You already know where the clothes is. So you're here and there. Now, again, if you're fine with taking a knee or lunging, you can do that too, bending at the hips. And then back up. For the front loader, the top loaders, where you have to actually reach in your laundry machine, you want to have one hand supporting you while the other's reaching. You can have a staggered step too. You can lean on the machine. There's no rule that says you can't lean on it. It's yours. You bought it, right? Lean on it and then reach, or use your hands to support you. But anytime you have the support, it's going to support your back. You don't want to be far away and reaching in. The dryer, the exact same thing, guys. Feel free to use a step stool to sit down, grab your laundry, whatever you have to do to feel more comfortable. But I hope these tips kind of help you do laundry in a more comfortable manner. Okay. All right, guys, it's time to wash dishes. Who doesn't love doing that? I'm going to show you a few different techniques that I like to use, that I find it more functional and easier if you have hand issues or back issues too. I've got a couple of dirty dishes, and yes, they really are dirty. And a few things that I like to have. You can use your typical sponge, but I like to have little brushes that have handles. And for my glasses, a longer brush. That way I don't have to really dig into the cups, right? And so what you can do is, again, you can lean on your counter. Yeah, your tummy might get a little bit wet. You can possibly even put a towel on there. But I like to lean on my towel. You can also open up your drawer. Everybody has these drawers. You can lean and put one foot up depending if you have pain on the leg. You can alternate. This is if you've got a ton of dishes, by the way, because if you only got two, you're only going to be here a little bit. But when you're washing your dishes, there's no rule that says that you have to be scrubbing your dishes underneath where the water comes out. Have your dishes nice and close to your body. Nice and close, right? And then you're only rinsing over here. Again, you don't have to wash the dish far away. Nice and close to your body, wash it, and then rinse it. For your glasses, when you have sponges, you have to really reach in there. If you have hand problems, that can be difficult. So again, I like to use these long brushes because it has a grip that I can grip a little bit better. And then I just have to hold it, and then it's easier to wash, right? Again, you're washing your glass nice and close to you, and then you rinse it far away. There's no rule that says you got to be washing all the way over here. So hope those tips help you guys get the dishes done quicker. Just kidding. All right, guys, now I'm going to show you how to get in and out of bed a little bit more comfortably, especially when you're in pain. We're going to use the log roll technique. All right, here we go. So what you want to do is sit on your bed. A lot of times people just lay down in bed, something like this, right? You just lay down and then you get up like that. But when you have back pain or neck pain, there's another way that'll help you do it more comfortably. So you want to sit on your bed, and what you're going to do is lift your legs sideways, and then your hand's going to kind of help support you at the same time. So we're here. I'm going to do that a little bit slower. So we're just laying down sideways, feet come up here. And then you can always turn around if you need to, or turn the other way, whatever you got to do. And to get up, we want to do the same thing. If you're sleeping like this and you're waking up, you want to roll over. And at the same time that you're going to drop your legs, you're going to push off with your hand. So it looks like this. I'm going to do that one more time. Here, and then roll. And then when you're getting up, push off, feet down. There. Hope that helps.
Well, thank you for watching. I hope I was able to teach you a thing or two. I am very proud of each and every one of you for taking time today out of your schedule to be here and take charge of your life. So thank you, and we will see you soon.